Today we're going to talk about what is type 2 diabetes. A lot of you might even be worried that you might have it. Type 2 diabetes is this disease process that often your body is losing its capability of just controlling blood sugar, one of those basic physiological functions that your body should be able to do. Hi, I'm Dr. Crockett, and this is Dr. Crocker with Zeal Integrated Health. And oftentimes these processes can be ID'd very simply by running a few tests. We can check something like fasting glucose. We can look at our hemoglobin A1C levels and know whether somebody is struggling with controlling their blood sugar. But there's so many people out there that are suffering from it, so many that don't know they have it. The statistics are alarming.
They are. They really are. You see out there that there's almost 30 million people that suffer from type 2 diabetes. There's another 84 million people that are pre-diabetic. That's 10% of these people don't even realize that they've got this. This is a situation that's really affecting people all over. And unfortunately, the reason why is because in the early stages of this, there's not a lot of signs and symptoms. And so it just goes unchecked, like we talked about in the beginning. I just feel fine is one of the biggest words.
I can't tell you how many times a patient walks into our clinic and they say, I feel fine. I wouldn't even know I had diabetes unless they tested me. And so when you look at the number of people out there that are pre-diabetic, 1 in 10 have been identified that they have pre-diabetes. So there's so many people out there that are struggling with this that don't even know. So I want to talk about some of the signs and symptoms that people can look for. And oftentimes they start out so they're very, very slight. You may not even pick up on them yourself. But it's something like maybe you're just noticing that you're thirsty more often. You're reaching for that bottle of water more often, or you're trying to get, oftentimes we're reaching for the wrong type of hydration product, right?
Exactly.
But oftentimes it starts with that. And then obviously with increase in fluids,
you see that frequent urination that comes right along with this, and you think, well, why am I going to the bathroom more? What is happening with this? Then comes along from there is you're fatigued. You wake up, you say, I went to bed early last night, but yet I don't feel rested when I wake up in the morning. You're just not getting that energy that you need throughout the day, so then you reach for your energy drinks or you increase your coffee. And then that just causes more and more issues from there.
You bet. And if you think about this, when you're having troubles just managing blood sugar, sugar is a fuel source. So if you cannot burn sugar, you're going to have a decrease in your energy. I haven't met a diabetic that's not really dealing with some energy issues.
Not at all.
They just don't exist. It's part of that metabolic syndrome.
That's the truth. And then, you can go things from like frequent yeast infections or maybe even a reoccurring yeast infection. You're going to things, your wounds don't heal as good as they should. You might even have some numbness or tingling in your hands or your feet. That's one of the big things that we see. And then you may be on a routine blood work, your doctor might mention, that liver's just getting a little bit fatty. You need to, you're going to have to lose some weight, or you're going to have to exercise, is where that always goes to from there.
You bet. So these things, as the disease progresses, these signs and symptoms typically progress. But the key is just early testing. And if we break this down, we typically look at things like the body's losing control of blood sugar from really a couple perspectives. Either your body's not producing enough insulin, or it's becoming resistant to the insulin. Now there's reasons for that, right? That's just the beginning of the causes when we look at what's causing diabetes, and we know there's several underlying factors. So let's talk a little bit about those and kind of explain some of those.
So one of the first things is that it could be that you have either insulin resistance where your body's just physically not accepting the insulin. Your pancreas is more than likely working. You're producing as much insulin as your body needs, but you cannot get it into the cell for your body to use it up. The other thing that you see a lot of is you see your liver is actually excreting too much glucose. You're not absorbing into your body, and your liver is just pushing too much out into your system.
A lot of times you start looking at like insulin resistance, we start thinking about things that might be setting on an insulin receptor, blocking the insulin from being able to just attach to that receptor and move the glucose across the cell membrane into the cell. This can be things that are internal. Hormones oftentimes will set on a receptor. So you see this with pregnancy, gestational diabetes. Can be oftentimes the estrogens are building up, and these estrogens will bind to insulin receptors and block the insulin from working. But we also see other hormones do that in the body, and we see other external toxins that can bind to these receptors as well. So environmental toxins, biotoxins, they bind to the receptor and create that issue with controlling blood sugar from a receptor side versus being able to produce enough insulin. Those people are probably producing plenty of insulin.
Yeah.
I'd say maybe 10% of the cases are dealing with a situation where the pancreas isn't producing enough insulin. It's oftentimes rare that the pancreas isn't doing its job.
Yep, that's true. Then you have to look at other things like autoimmunities. You know, we talk about one type of diabetes today. We're talking about type 2, but really there's 4 different types of diabetes. And we talk about this in one of our other videos. So if you can go on there and you can learn about the different types of diabetes as well. But there is not just 1 or 2 types of diabetes. So that's one of the things that you have to look for. You have to also look for this adrenal cortisol dysfunction. You know, you wake up in the morning, you have high blood sugars, and you're really not for sure why you're having this. You know, maybe you're going to get these testings done, and they say, your doctor says, well, A1C looks fine, but yet you have high fasting blood sugars in the morning. That's an issue that's going to lead to a bigger problem down the road.
Yes, it's pushing you down that diabetic pathway.
Yeah,
so
for sure.
Definitely. So there's all kinds of metabolic issues that can evolve into this. Oftentimes we'll find undiagnosed thyroid hormone imbalances as well, but it all starts with testing, you know, identifying who's falling into this pre-diabetic category, who's falling into a diabetic category. And, you know, when we look at testing, there's, you know, a multitude of different tests to help analyze people. And we can talk about a few of those. Let's run through some of these things. We mentioned already the hemoglobin A1C and a fasting glucose. A lot of times the fasting glucose is ran in a metabolic panel. So typically you'll get that complete metabolic panel that's going to have your fasting glucose in it. So you can either talk to your doctor or give us a call on those. But there's some other markers that can give you indicators that you're having troubles with sugars.
Yeah, one of those is going to be a C-Peptide. That C-Peptide is going to really tell you how well your pancreas is producing insulin. You don't just want to rely on, well, your pancreas is getting sluggish, it's not working. There's ways to test that. And there's other things like a Glycomark that's going to really tell you a lot shorter time frame than an A1C. An A1C is typically over a 90-day period, where a Glycomark typically goes over the last 2 weeks to give you a better understanding of where you're at.
So, and then just basic urinalysis. Some people, once your blood sugar goes over 160, you start spilling sugars into the urine, and it's going to show up there. So that's a good way to identify if your sugars are getting over 160. And just to go back to the C-peptide, you know, when your pancreas makes insulin, bound to that insulin is this C-peptide protein. So it's a 1-to-1 ratio when we look at that. So this is a really good marker to analyze the pancreatic function. And like I said, oftentimes that pancreas isn't where the problem is. It's usually on the receptor side, and some of those things interfering with the receptor being resistant to the insulin. So I hope this gives you more of an understanding of what type 2 diabetes is and what you need to be looking for to identify if you're maybe falling into one of these categories of being pre-diabetic or diabetic. And go back and check out some of our other videos. We've mentioned several things today that we've went into depth on in other YouTube videos. So go check those out. And if you got more questions, give us a call here at the office.